Welcome back, folks. For more than 40 years, the Roadrunner Food Bank has been helping those struggling with food insecurity. And with 1 in 5 school-aged children dealing with daily hunger, the food bank is working to address the food access throughout rural schools in the state, all thanks to a little help from United Healthcare. Lucy Moreno leads a humble entourage of volunteers at Sunset Elementary School, just south of Roswell. It's a routine she's done for years, providing food donations to those in need in this small pocket of southwest New Mexico.
I love it. I love doing it. I love helping people.
On this particular day, Lucy and her team are filling up cars and trucks with food from Roadrunner Food Bank. Hauled in from the distribution center in Albuquerque, this 18-wheeler brings with it hundreds of pounds of canned goods, fruits, and vegetables for families at Sunset Elementary, a school whose student body is comprised of children from low-income families. Unfortunately, this challenge isn't even remotely unique to Sunset. In fact, New Mexico ranks as the second highest state for childhood food insecurity in the U.S., with 1 in 5 kids at risk for hunger.
There are a lot of reasons why food insecurity exists.
Katie Anderson is Chief Programs Officer for Roadrunner Food Bank. She says among the most prominent causes of food insecurity is, of course, poverty.
Any place where there's high levels of poverty, you're going to find food insecurity.
But there are other reasons so many New Mexico children struggle with hunger. One of them having everything to do with the sheer size of the state.
We have entire communities and counties that don't have a single grocery store.
Catron County, which sits along the state line of Arizona and New Mexico, is a prime example. According to Anderson, the more than 3,500 residents of this county have to travel long distances for a convenience urban dwellers take for granted.
The people who live in that community have to either drive over to Arizona or drive sometimes all the way to Socorro or even into Albuquerque to get groceries.
Imagine having to drive 129 miles just to get fixings for tonight's dinner. To bring nutrition to those in desperate need of it, Roadrunner launched the Childhood Hunger Initiative 8 years ago.
And the purpose of that was to really reach students and children and their families in a much better way.
The program is similar to a backpack program Roadrunner ran previously. Kids at schools like Sunset were sent home with a backpack full of about 3 to 5 pounds of food. However, if a child is experiencing food insecurity, most likely their family is too.
Kids were taking those backpacks home and sharing the 3 to 5 pounds of food with their entire family. Mom, dad, cousins, grandma, grandpa, siblings. And as you can imagine, 3 to 5 pounds of food doesn't go very far, particularly when it's spread out amongst a lot of people.
The new initiative multiplies that number to about 50 pounds of food. So mom, dad, the siblings, and yes, grandma can all share in the food donation provided by Roadrunner.
We know that there's a lot of nonprofit partners out there that are doing great work, and we want to try to find a way to work with them.
United Healthcare recently awarded the food bank a grant to help the families of Sunset Elementary through the Childhood Hunger Initiative. Through the funding, Roadrunner is able to purchase food with better nutritional value, including more fresh fruits and vegetables. By providing healthier options for families, United Healthcare and Roadrunner are working to prevent conditions like obesity and diabetes, as well as other health concerns like anxiety and even asthma through the food New Mexicans are eating.
That helps our mission of helping people lead healthier lives and also helps their mission in providing needed resources or other materials to people in need.
We have the opportunity to really introduce kids that are food insecure to healthy food, and they're eating that good healthy food at a young age, and perhaps down the road don't have to deal with those same health issues.
Sunset Elementary is one of 100 schools Roadrunner helps across 14 counties in New Mexico. On average, the food bank is able to move 2.5 to 3 million pounds of food annually to schools in need. But that amount of food, in addition to the rising costs of gas to move it, comes with a hefty price tag.
That's why it's so important to have funding partners like United Healthcare that believe in the importance of addressing food insecurity, nutrition insecurity for students, so that they can grow up healthy and well, and that we can continue to expand the reach of this program so that more young people and children in New Mexico have access to it. We'd like nothing more than to see a completely food secure population in New Mexico, and make sure that all the kids in our state have what they need in order to grow up and be strong and do what they want to do in life.
With nearly 900 schools spread out through New Mexico's 33 counties, the Child Hunger Initiative has plenty of room to grow. United Healthcare saw the gap between the need and resources and stepped in to help, something they have now done with 8 nonprofits in the state.
United Healthcare invests in community organizations across the United States. And in New Mexico, what we've done is look at the goals of the state Human Services Department and the state health department, and look at nonprofits out in the community and how they're really addressing these goals. And when we go out and see nonprofits, we talk to them about their mission and what they're doing, if they have any gaps. And we really try to address those gaps with funding, or if we have other resources that we could help them, because they're part of the fabric of the healthcare in New Mexico.
Now in 2022, United Healthcare awarded more than $1.1 million to nonprofit organizations. And you can keep up with all that they are doing in the state by going online to uhccs.com/New Mexico.